Module 3 Exercise and Diabetes. Welcome to Module 3. In this module, we will learn all about exercise and diabetes and how we can exercise effortlessly at home. Insulin and exercise. From previous lessons, we learned that exercise improves insulin sensitivity. This is the state where insulin acts as a bridge so that glucose enters the cells easily. When insulin does not work well, it's called insulin resistance. Whenever we exercise or move our muscles, they use up energy. Glucose moves into the cells and combines with oxygen to make this happen. This is what happens in the first few minutes of exercise, and we need insulin for it. As we continue to exercise, we use up all the glucose in the bloodstream, so our muscles need energy from somewhere else. This is when we need to use our energy stores of glycogen in the muscles and liver and fat from under the skin and in the abdomen. Anti-insulin acts as the bridge when we need to use our energy stores. So when we exercise, we need both insulin and anti-insulin hormones working together. For many patients with diabetes, insulin and anti-insulin hormones do not work properly. When they exercise, they can't use glucose or any other energy stores well, so they get tired easily. There are other reasons why they get tired. They have smaller muscles. This is because, over time, they've had to break down some of their muscles to provide energy. This happens more in patients who have had diabetes for many years. The effect of insulin and other glucose-lowering medications. Insulin and other glucose-lowering medications force glucose into the cells. When you exercise while on these medications, blood glucose can be used up faster. There's no new supply of energy if the anti-insulin hormones aren't working well. Low blood glucose is called hypoglycemia. Many diabetic patients get discouraged from exercise because of this. The best response is to start gradually. Make sure you have lots of water and a sugary drink nearby when exercising. The sugary drink helps to replace blood glucose fast. The next thing is what type of exercise diabetics should try. High-intensity training. This is a form of exercise that is beneficial in patients with diabetes and also for people who want to be fit and healthy. High-intensity training is different from regular exercise. It's done at full blast for a short duration and so is easy for most diabetics to do. It can be done anywhere and fits easily into most people's lifestyle. Before we go further, what exactly does being fit mean? There's a common prayer in Africa. May you grow old and see your children's children. To reach a ripe old age, your heart must always function optimally. Our hearts pump the oxygen needed to produce energy all over the body. Once the heart stops beating, a person dies. High-intensity training improves strength and function of the heart and other muscles. This is what keeps us fit. In other words, fitness is how well your heart functions. Assessing fitness. We can assess fitness using a formula developed by scientists. Uth Sorensen Overgaard Pedersen. First, count your heartbeat for 1 full minute while resting. Next, do some exercise as fast as you can till you get tired. You could jump, skip, or run, then count your heartbeat for a minute. Most of us won't last more than 1 or 2 minutes. Use the formula shown to calculate your VO2 max. This gives an idea of how fit your heart is. If you can't do it yourself, get someone who's good at maths to help you. Practicing high-intensity training. The goal of high-intensity training is to improve the strength and function of the heart and other muscles. You push yourself as hard as you can for a short time so your heart and muscles work at full blast. The whole exercise takes 5 to 20 minutes depending on what your body can tolerate. So you exercise as hard as you can for 30 seconds to 1 minute, rest for 2 to 3 minutes or long enough for your heart rate to come back to normal, and repeat the process 2 or 3 times. That's all you need to do for high-intensity training, and you do this at least 3 times a week. With regular exercise, you need to exercise for longer periods because you don't use all your muscle fibers. High-intensity training forces you to use all your muscle fibers, so short bursts are effective. It helps to burn belly fat, improves insulin sensitivity, and improves your heart health and overall fitness. High-intensity training can be done indoors or outside. Outdoor methods could be running, cycling, and swimming. Indoors, you could use a treadmill and the cross-trainer. Many other exercises could be included, and we'll see more of this later. Exercise and weight loss. Apart from improving fitness, exercise also helps with weight loss. Remember, when you exercise, anti-insulin hormones use up fat stores to produce energy. When we exercise consistently, we gradually use up our fat stores, and this is how weight loss is achieved. It's gradual because we can't use up all the fat at once. Fat is calorie dense, meaning a tiny amount of fat contains a large number of calories. 1 kilogram of fat contains about 7,000 calories and 1 gram about 7 calories. The amount of fat used up during exercise depends on our weight, how long we exercise, and how hard we exercise. The longer and harder we exercise, the more fat we use up. But because fat is calorie dense, it's difficult to use it up quickly. This formula can be used to get an idea of how much fat we use up when we exercise. Weight here is in pounds and distance is in miles. You can get someone good in maths to help with this as well. A major problem with exercise and weight loss is that a lot of people eat more after exercising. Exercise makes us feel good or feel that we can eat more since we've done our exercise. If we exercise and use up 300 calories and then go on to eat a meal of 1,000 calories, what we've done is gain 700 calories. In other words, we've increased our fat stores instead of reducing them. Benefits of exercising. Exercise is beneficial for many reasons. We've mentioned some already, but we'll go over everything again here. 1. It improves fitness. 2. It improves insulin sensitivity. 3. It helps with weight loss. 4. It keeps us young. 5. It helps our brains function better. 6. It reduces the risk of cancer as cancer risk increases with weight. 7. It strengthens bones and muscles. 8. It boosts our mood. 9. It helps us sleep. 10. It improves our immunity. We've talked about high-intensity training, which is the best method of exercise for people with diabetes, for people who want to live healthy, and for people who live an urban life and do not have time to exercise, because you can do it almost anywhere and in a short time. In the next module, we'll learn some more tips to stay healthy with diabetes.